Hey, Team BCN. Thank you so much for joining me for today's podcast episode. Liz Fowler, President and CEO of Bluegrass Navigators, joins us today to share a little bit about her journey and why she enjoys working alongside you. Liz, welcome.
Hi, Heidi. Thanks for speaking with me today.
Oh, of course. Thanks so much for taking the time. So you've been President and CEO of BCN for a little over 8 years. How did you come to work here?
You know, Heidi, few people in Kentucky realize what a national reputation Bluegrass Care Navigators have. We used to be known as Hospice of the Bluegrass, and I worked for a large hospice program very similar to Bluegrass Care Navigators in Southwest Florida. And we were always watching what Bluegrass was doing. And we frequently said, I wonder if we could call Bluegrass and ask them about this. So when Gretchen Brown, my predecessor, was retiring, there was a national search. And it was a little bit uncanny when the announcement came out that Bluegrass Care Navigators, or Hospice of the Bluegrass, was looking for a new CEO. A number of people emailed me and said, Liz, you should think about this job. Now, I wasn't looking. And I thought, no, I could never do that. Well, after a little bit of encouragement, I did apply. And really immediately fell in love with the people here. The board of directors that interviewed me and thought, yeah, I did have a lot of experience that I thought I could bring to this successful organization to help it continue to grow and provide the type of care that our community needs. Mm-hmm. So it quickly has become home to me.
Yeah. What was it like moving from Florida? Had you lived there your whole life and then moving to Kentucky?
So I actually grew up most of my childhood out in the Philadelphia suburbs. And it was in the horse country outside of Philadelphia. So Lexington felt very similar to that to me and my husband. And my extended family is from the Western Maryland Appalachian Mountains. So we spent a lot of vacations and our family time in Western Maryland. So the mountains of Kentucky feel very much at home to me too.
Yes, that makes a lot of sense. So I'm relatively new. I just started in September. And in HR onboarding yesterday, they asked us why BCN and why now? So what is your why for why you work at BCN?
You know, to me, it's very meaningful to contribute. And I see the difference that we make in people's lives every day. And, so many folks, when they hear about hospice, oh, how do you do that? Isn't that so sad? And, to me, it's very, very rewarding to help people at a very challenging time of their life and make every day better and just help them live life to the fullest. Being able to help and support our caregivers, I'm not directly in the field, but knowing I'm behind the scenes, helping our caregivers be the best they can be in people's homes and helping them is just very meaningful to me.
Mm-hmm. For sure, for sure. In a similar way, that's one of my whys for why I wanted to come work for BCN, because I wanted to make a difference in an administrative role in helping other people have the best care that they could. So
yeah, Heidi, that's really important. I like to tell new orientees and our team members, if you're a clinician in the field, you're helping a family member. And if you're not a clinician in the field at BCN, you're helping that clinician in the field be the best they can. Mm-hmm. So we all have a role helping our patients and families.
Yes, for sure. For sure. As I've said many times up to this point, I'm very new to BCN, but one of the words that stood out to me in my interview was the word calling, and that people are called to spend their life in healthcare, and specifically hospice, since that is one of BCN's main service lines. You've spent many years in healthcare. When did you first know that healthcare was right for you?
Actually, when I was in college. And I had a great advisor. I really considered him a mentor. And, I was a helper sort of person. And I was thinking about teaching. I was thinking about pre-med and med school. But he recognized that, frontline caregiving might not be my best strength. but helping people in a different way. And I did a selected studies in health education at that point, and just really learned that there are other ways to help people in their healthcare journey besides being the traditional roles, doctor, nurse, teacher. And I'm glad I found a good fit through a good mentor.
Yeah, for sure. Can you tell me a little bit about your career journey in healthcare to get to BC? And we talked a little bit about that at the top of the show, but could you kind of flesh that out a little bit more?
Sure. With my mentor's advisement, I went on to get my master's in public health. Now, I'm also the first college educated in my family on both sides.
Wow.
And my family was like, what are you going to do with a master's degree?
Mhm.
And I had to do a lot of that figuring out and learning on my own. And then when I graduated, my husband and I moved to Southwest Florida. And at that time, there were no universities. It was a small town. And my first job was actually cardiac patient education. I needed work. And I worked in the hospital, but soon went into the staff development department. And I was watching the hospice organization grow. And I was there 3 years. And then at that point in time, there was an opening with the hospice organization. And I began my career in hospice after that brief experience in hospital administration.
Yeah. Why hospice?
My family, as I mentioned to you, was mostly from rural Appalachia
Mhm.
in Western Maryland. And my mother and father were the only on both sides of the family that had left the area. And we first moved to Boston. I actually was born in Nashua, New Hampshire. We moved to Boston, then Long Island, and then Philadelphia when I began in grade school. And we always spent our time off from school in Western Maryland. And with a large extended family and many older family members, we were always taking care of our own at home. And my mother was really relied on to give her sisters a break from
Mm.
because they had full-time caregiving responsibility. So taking care of our own at home was just a natural for me. And I saw that wasn't happening with my friends and neighbors in Philadelphia, or then when I went on to college and graduate school. And I just knew that was the best way to care for our loved ones. So the
Yeah.
hospice movement was always inspiring to me because, the few of us recognized that the hospice Medicare benefit didn't come along till the early 80s.
Yeah, I didn't
So
know that.
there really was not a good way to care for people who needed care at home and to spend their final days with the support of a healthcare system. You either did it with family or at the hospital.
Mhm.
So hospice just beautifully began to support families on this journey. But
Mhm.
prior to 1984, most families members had to manage this care on their own.
Oh, and that's such a huge thing for a family in a very difficult time if they had to manage that all themselves.
Yes.
And I really appreciate your story about how it like, your love of hospice and kind of calling to hospice grew out of your childhood and just watching people care, like, caring for others is just part of who you are.
Yeah. Well, and Heidi, another story that I have shared with our team members, and they asked similar questions when I first came here 8 years ago. I had a brother that was 13 months older than me. And when we were in middle school, he was hit by a car on his paper route
Oh,
and
no.
and passed. And so my family had sudden and urgent bereavement needs. And I just understand how difficult that time is for a family. Never really fully understood how difficult it was on my parents till I became a parent, but certainly I knew what it was like to have a sibling I was very close to. And we had some really good bereavement counseling.
Mhm,
And at that point in time, there weren't hospices offering it, but we went to a church that offered some counseling. And it was a life changer for my family at that point. So I
mhm,
have deep, deep respect for the
mm,
counseling services that we also provide in our community.
mhm, mhm. And what better way to be in the role that you and our other team members have? I just listening, being here a month or something, a lot of people have had some kind of experience with hospice and then see this as a way to give back to others. Yeah.
Absolutely.
One of the things that I've learned about you is that a common denominator in your life has been building relationships. Why is the human aspect so important to you?
Heidi, I knew you were going to ask this question. And I thought, gee, I don't know. It's just part of my fiber. We're all humans.
Mhm.
And, well, I tell my kids, a big skill to learn in life is how do you influence people? And you help them to learn and form their own opinions and be the best they are. I just think that's a key to a successful life. And yeah, we're humans, and some of us are introverts, some of us are extroverts, but we all need people,
Mhm.
and we all are people. So yeah.
For sure, for sure. In many ways, piggybacking off that question, you not only you build relationships with people in and outside of BCN. You not only lead BCN, but you also serve as a mentor to the company as a whole and foster an environment of growth and development. Why is this mentoring style of leadership of such value to you?
Well, I shared with you my story early on
Mhm,
in graduate school. I mean, being a kid that didn't have any role models of anyone that had gone to
mhm,
college, I really needed that. And certainly I value that individual for helping to change my life and create who I am. And I believe that it's very important for or having us help people be their best.
mhm,
And you'll hear me say this here. I want people to be their best at home and their best at work.
mhm,
Our work life is very important, but I know if you're struggling with something at home, it has to affect your work life and vice versa. And our work is hard to really be available and fully present for our patients, for our families, and our team members.
mhm.
Um, we've got to do what we can to make individuals their best. So, yeah, that mentoring is just a important part of my philosophy.
Yeah. Yeah, this next question isn't one on the list I sent you, but I was just thinking about it. As you said, you were the first thinking about mentoring, not having role models, and being the first college graduate on both sides of your family to go to school, and being female too. That I think that plays into it a little bit too. What was that like for you?
Gee, Heidi, I don't know. I didn't know any different.
Yeah.
I didn't know any different. Um, I had a lot of support from my family, and I guess that probably helped foster a lot of the independence people see in me now.
Mhm.
I had family support, and I knew there were loving people behind me, but there was a lot of figuring out we had to do together, or I
Mhm.
had to do on my own. And say, hey, mom and dad, you have to help me with this application, or I just had to learn to do it on my own.
Mhm.
So it just fostered a skill of problem solving
Mhm.
and independence.
Which has served you well. So I see you in the hallway every once in a while, our paths cross. But what does a day in the life of Liz Fowler look like?
Well, it's usually pretty busy. I like to be busy. I usually start my day early. I get up early, I exercise, or I read and meditate. I'd like to be one of the first people in the building. I have a lot of meetings, and I try to schedule time in between so I can talk to people in the hallway. But you'll see me oftentimes, I'm just running from place to place. That's not a good thing, though. I wish I would slow down a little bit more and spend time with more individuals. So lots of meetings, lots of follow ups, lots of phone calls, lots of meetings with people in the building or in within BCN, I should say, as well as our community members,
Mhm,
whether it's nursing home administrators or someone at one of our hospitals or an insurance plan or a donor. This morning, if we looked, I started the day with having coffee with one of our donors. And I've had some calls this afternoon with some other individuals that might be future board members for
mhm.
us or a nursing home we're developing a relationship with. So a lot of that sort of stuff. If I don't have an evening meeting, I usually leave the office about 6:30 and go home and have a nice dinner with my family. I like dinner at home. We don't eat out a lot. And usually a TV show or hanging out at the house for a little bit. I have a nice back porch. I love sitting outside.
Mhm.
And then I try and get to bed at a decent time.
You'd have to if your day starts early. What do you like to do for fun?
I love taking a walk, usually a lot of time with my family when I'm off. I like hiking, exercising, anything outdoors. Like I
Yeah.
said, even to sit outside on my back porch in the morning and have my coffee, that's a treat.
Yes, I feel exactly the same. Do you have a favorite trail that you've hiked or that you want to hike?
I've had the privilege of hiking a lot of places. Parts of the Continental Divide in Colorado I've hiked. I'd like to try the Pacific Coast Trail. That's on my list to do some hiking there.
Yeah, that would be beautiful, I'm sure. So, in preparing for our conversation today, I read an article about you from First Group, and I love this quote that you shared when you were talking about staying true to the mission and patience of today, but also planning for the future. And you shared this quote by Wayne Gretzky, the great hockey player. And he said, "A good hockey player plays where the puck is. A great hockey player plays where the puck is going to be." So, what does the mission of today and the vision for tomorrow look like for BCN?
Heidi, I'm glad you asked that question because I know lots of people ask, well, why are we doing all the things we do? So we talked briefly about the Medicare hospice benefit, and it's
Hmm.
relatively new in the US healthcare system. And what has happened now is that not only folks at Medicare, but at insurance companies realize, wow, what we do in hospice is really valuable to the healthcare system in that it cares for individuals in a way that's well coordinated. The cost of that care is usually less costly, and families are usually happier with it. There's this big aha going on. Oh, hospices know what they're doing, and it's a great way to care for individuals. But we have been defined by the hospice Medicare benefit for so long that individuals have to have a prognosis of 6 months or less. And where's the puck going? Is people are saying, hospice is only one portion of end of life care. End of life care shouldn't have to be defined by a prognosis of 6 months or less. Many folks are seriously ill and need our sort of care well beyond that 6 months prognosis. So, what's that look like? Today, it looks like PACE. And some folks are even looking, well, what's a home health benefit maybe look like? And that's why, or the home primary care that we're providing for folks that can't get out of their home. And we see more and more companies looking for that for their employees or insurers looking for that for their beneficiaries. That I just see that the great interdisciplinary holistic care we provide, we're going to be able to take what we do so well in hospice and provide it to a much larger folks of people. And it might be different because folks might need the intensity they get in their final months, but certainly a well thought out, well discussed, well prepared plan of care for individuals can certainly benefit them from the sort of disjointed health care you get now.
Mhm. So when I had my HR onboarding, you spoke at that too. And so what you're saying now reminds me of that, that your goal is to provide healthcare from birth throughout all of life. And I just think I just really appreciate that vision for the company that I work for. So, November is National Home Care and Hospice Month. And of course, we are grateful for the nurses, aides, therapists, social workers, chaplains, doctors, and volunteers who make a life changing difference for patients and their families daily. As you reflect on the work that our team members do, what are you especially proud of and grateful for?
So I actually had a conversation with one of our chaplains this morning, and I am really, really grateful for our sense of teamwork at Bluegrass Care
Mhm.
Navigators. Our smaller teams, our larger teams really work to support each other. And, we can tell when we're hiring folks, we really look for that quality of an individual's ability to work as part of a team. And, our really high performing teams hold each other mutually accountable. We all want to do a good job. I firmly believe that. And no one comes to Bluegrass Care Navigators to just do an okay job today. And we all have good days and bad days. And when you have a team that can say, hey, I got you on this, or you're really great at this, how about you do this for us? And I am happy to do this job I know you hate. It's just getting to know each other, finding out what our strengths are, using everyone's strengths. I just see such great teamwork and individuals supporting each other well every day that, my goal is to continue to hire great team members to be available,
Mhm.
uh, to continue to expand the work we do. I know lots of times when we are short team membered, it's not because we want to be. We just got to find some more great ones. So, and I just love that sense of teamwork that I see here every day.
Yes, for sure, for sure. We all have difficult days, whether we're in an administrative role or in a clinical role. Can you tell me a story about what keeps you going when it might be easier to just throw in the towel today?
Yeah, I don't know if I necessarily have a story. And I don't know when I started to think this way. And it probably was in my early days of hospice. When you have a bad day and, you know, feel down on yourself, I always think, gee, I can walk. And I love taking a walk.
Mhm.
And even though it's a bad day, I can walk. And it's those simple things I think that we need to focus on. I tell folks, you don't work at hospice for very long till it changes you somehow. And
Mhm.
I think for me, that's my perspective that, I just need to love and value the very simple things in my life. And for me, and I guess someday I won't be able to walk, and I hope I have, loving people around me that help me see what I am able to do at that point in time and enjoy life.
Yeah, for sure. Liz, we've had a great conversation. I have one question that I'm going to start asking everybody who comes on the podcast. But before I do, is there anything else you'd like to say that I didn't know to ask you?
Well, Heidi, I just hope that team members feel welcome to call me, ask me, give suggestions and ideas. I know we have a lot of really smart people at our organization with a lot of great ideas, and I value them all. We can't do them all.
Mhm.
And I hope just because we can't, people don't feel like, well, just because their idea is not used this time doesn't mean that another one in the future is not really important. So tell
Mhm.
team members, keep sharing their ideas that'll make us better, help us meet the needs of individuals in our communities.
Yeah, it's great to be invited to share in open and reciprocal conversations. Yeah, for sure. So so I lied. I do this frequently when I say I have one more question and then another one comes to mind. So I'd like to ask you what you would tell a new team member just getting started, what you would want them to know.
So I think people are always surprised at how complex the care that we provide is and how long it takes to get to learn it.
Mhm.
That we really do have that holistic interdisciplinary practice, and it's different than what they might have experienced in other traditional forms of healthcare, like home health or a doctor's office or clinic or hospital. And really, just to be patient with yourself as you learn.
Mhm.
You might be a very seasoned and experienced professional. And even if it's on the accounting or IT or HR side, we're pretty complicated with the things that we do. So just be patient as you learn.
Yeah. Yeah, that's a good word. That's a good word. What would you tell somebody who's been here a while to kind of encourage them on their journey?
Well, I always do tell team members we want to know your dream job.
Mm. Mhm.
And, we all need to have dreams and hopes. And it may be here at Bluegrass Care Navigators. And if it is, how can we develop you and help you gain the skills to have your dream job? Or if it's something that's not a job that we'll have available at Bluegrass Care Navigators, I feel that's okay too. Helping you to be your best, hopefully, while you're learning and developing the skills to what's important in your future. Hopefully, while you're here, you're being your best and contributing to us, and we have something to learn.
Yeah, definitely. All right, now for my last question. Because this podcast is all about getting to know our team members, what is one thing that others may not know about you?
So through the 8 years, I've shared a lot of my little secrets, Heidi, but I think this is one I haven't yet.
Oh, that's exciting.
Well, I don't know. It was one of the best days of my life, but I got to go for a ride in the Goodyear blimp with
No
my
way.
favorite aunt. So, yep, that was just a really cool day.
How did that happen? That's awesome.
Well, I had a little help. My father's career was with Goodyear, and he had a number of opportunities through the years to get on the Goodyear blimp, and I was never available. I was at a swim meet or, somewhere as a kid that he just couldn't take me. And I happened to be an adult in Southwest Florida. My girls were both 1 and 3. And he called up one day and he said, "Honey, you can ride the blimp this afternoon if you get over to the East Coast." I threw my girls in the car, and but he said, "There's high winds. It might be canceled." I said, "Well, I'm going." So I got in the car. I drove across to Alligator Alley, picked up my aunt, and I was going to take my uncle. He says, "I'm not going. The winds are too high. You won't get to fly today." Well, my aunt, she was like, "I'm in the car with you, Liz. We're going." And we did. We got there. The winds were really high, and they're like, "I don't know if you can go." But the funniest thing about the blimp is, Heidi, it doesn't have a motor. It does float. Well, I guess it has a little propeller thing, but it doesn't have an engine. Well, I guess it has an engine. But anyway, it's just a very different sort of thing. They actually pull it out of a hangar like a balloon, like in the Thanksgiving Day parade, with people holding it. We actually had to climb up a little ladder that was swinging. And here I am with my 1-year-old in my arm climbing up. And we had lifted my 3-year-old up into my aunt's arm. And as we're getting ready to leave, they're like, "They need more weight. They need more weight." And they started throwing sandbags, running after us, throwing sandbags on. And I thought, oh my, what have I done? Putting me and my aunt and my 2 children in the Goodyear blimp that looks like it's chaos. Anyway, we got up and we landed out obviously very safely, but it was just the coolest thing. And I'm glad we took that risk in life.
That is so exciting. What an adventure. Thank you so much for sharing that. And Liz, thank you so much for your time today. I've really enjoyed the opportunity to get to know you a little bit more and to share that with our team members. So thank you.
You're welcome, Heidi. Thank you.